Toledo is doing to fight gun violence and says Washington can do more.
It takes many people to save a life after someone is injured in a mass shooting. Tonight, Emma Henderson sat down with a trauma surgeon to learn more about what they see when someone with a gunshot wound is rushed into the ER.
The clock starts the moment someone gets hit. Toledo Hospital is a level 1 trauma center, meaning they always have a trauma surgeon like Dr. Steve Stanek in-house and on call.
We see a lot more damage from smaller caliber bullets because they tend to ricochet off bones, pelvis, other organs, and so they can hit multiple different organs with one bullet.
If the bullet hits zone 1, meaning somewhere in the torso, this can often be the case and the person is rushed into surgery.
Usually that starts off with a massive amount of blood, and everyone's heart rate goes up in the room, but we have to get control of that.
Once bleeding is under control, repairs can begin.
Then we start exploring each individual injury and focusing on each individual at a time, starting at the most devastating.
This is where extra units of blood are vital to keep the person alive. The more blood they lose, the more concerns for recovery.
Once you lose your full blood supply or body volume in blood, you tend to be coagulopathic, which means you bleed from everywhere. So a small incision we did in the skin, which normally someone would form a clot, they normally don't do that.
This situation is for one gunshot victim. In an event with mass casualties, imagine this process multiplied, with some injuries more or less severe. That's why medical staff at Toledo Hospital are constantly training.
We do practice for mass casualty events like that. We have a game plan already in place. Here at Toledo, we do have 2 trauma surgeons on all the time, one always in-house.
Just in case a mass shooting hits close to home. In West Toledo, Emma Henderson for WTOL 11.
For full details on President Trump's visit to Dayton tomorrow and everything we know about the shootings there and in El Paso, head over